soon.
Couldn't go any further. I had to turn back.
You haven't even been gone for 15 minutes.
The room is spinning.
Do you feel sick?
Floating almost in the top. Yeah.
Sweating and it's just, no, that's crazy. No, I'm calling 911. This is nuts. Oh, I'm sorry. I know you're embarrassed. Yeah, so I think my husband may be having a heart attack.
3527, that's 10-4. I have a code 4 for you in Barrie. Address is 169 Johnson Street, 169 Johnson. It's across the Grove. You're responding there for a 60-year-old male, a shoulder breath, and chest pain.
Hi there, sir. My name's Julia. This is Darren.
Hello. Hi.
And what's your name?
Bob.
Bob. What's your last name, Bob?
Kennedy.
Okay, we're here for you today.
Yeah.
What's going on, Mr. Kennedy?
Well, I just went for my walk. I only got about 2 or 3 blocks, and I felt winded and I had some pressure. I just had to come back because I couldn't figure out what was going on.
Okay, Mr. Kennedy, we'll just get you over to the stretcher here, okay? Nice and easy. So what time exactly did this all start at?
Oh, it was about half an hour ago or so.
Half an hour? Okay. Have you ever felt like this before?
No, I walked earlier this morning and tried the same thing. And
History of problems with your heart at all?
no, actually, this is a surprising thing. I've been always in good health. I've never had any hospital stays.
Okay. And do you take any medication on a regular basis?
I took for a while. I was on high cholesterol medications. But
Okay, so no medications, no allergies, and no significant history other than just the high cholesterol?
yeah.
I'm going to give you some aspirin, okay? Just in case that discomfort that you're having in your chest is related to your heart. We'll give you that just precautionarily, okay? If there's some blood clots going in there, it can help prevent them from getting any larger, okay? So what Darren's going to do, if it's okay with you, is we're going to put a little intravenous in your arm, okay? That just gives us the ability to give you some nitroglycerin spray, which I'm hoping is going to help alleviate some of that pressure that's in your chest, okay? We've got ST elevation in leads V1 through V4, meets Stemi criteria. Okay, Darren, I'm just going to make a call to the interventionist.
Okay, Bob, you haven't had nitro before, correct?
No.
All right, so what I need to do, I'm going to establish an IV, so I can give you the nitro now. It's going to go under your tongue. I can get it up to you 6 times, okay? So what's going to happen, Julia's on the phone right now, and we're going to be directed to RVH. And when we get there, we're going to probably send you right up to something called the cath lab.
And he is experiencing some tightness in the chest currently, rated about a 4 out of a 10. Vitally, heart rate at this point is 60, and it appears to be sinus rhythm. Blood pressure 136/86. We've administered 160 milligrams of ASA, and we're just initiating a little bit of nitro to see if we can get some relief for him. But we'd like to come straight into the cath lab for that.
Perfect. Can you give him 180 milligrams of PO ticagrelor and head on over, and I'll activate the code Stemi team right away.
Okay, that's great. We'll be departing scene here shortly, ETA approximately 15 minutes.
Hi, locating. This is Farouk Hussein calling from the cath lab. Can you please activate a code Stemi? And we have a patient, Bob Kennedy, coming in from Johnson Street. ETA is about 15 minutes, and he's preloaded as usual.
How you feeling, Bob? We're just about at the cath lab now. Any change at all to the pressure that you're having in your chest?
No, not much.
Okay. Well, you're doing great, okay? We're just about there.
Hi, come on in, guys. We're all set for you.
At a 12 lead for you here. This is Mr. Kennedy, that we called about. So the trip was uneventful. No change at all with the pressure in the chest, still rated about 4 out of 10. Okay. It's had 3 sprays of nitro total.
Hi, Bob. My name is Kathy. This is my coworker, Kelly. We are RVH cath lab nurses. We're going to be assisting Dr. Hussein today with the procedure, and we're going to be moving fairly quickly here.
Hi, Bob. My name's Farouk. Nice to meet you, bud. How old are you, man?
6'1".
Excellent. Ever had diabetes?
No.
Do you have any high blood pressure or cholesterol?
Cholesterol. The high blood pressure.
Never had a heart attack or stroke?
No.
All right. We'll try to help you out. What time did the chest pain start?
Oh, about an hour now or so ago, I guess. I can't
Perfect. We'll try to help you out. Okay, let me explain the procedure to you a little bit. We'll give you a little bit of freezing here in the hand. 10 tubes to your heart. Take pictures. Should take about 10 minutes. After that, if there's an artery blocked, I'll put a wire down the artery. Open the artery with a balloon. Sometimes we get stuck out clot. We may do that if we need to do that, okay? And we put in a little culvert called a stent. It's a metal tube to hold the artery open to stop the heart attack, okay? You got to take an aspirin a day lifelong and a second medicine called Plavix or ticagrelor for about 1 year, all right? Any questions so far? Let me explain the risk basically. Those include a heart attack, stroke, dying after emergency surgery, surgery on the hand or the leg where we go, allergy to the dye, kidney problems, or requiring a blood transfusion. Those risks generally under 2 to 3%. We'll look after you well. I'll talk to you throughout the procedure, tell you what we're finding, and make a plan. Questions, boss? No? We'll get rolling.
right.
Just going to get your John Hancock here. All right, Chief. We'll try to help you out, okay?
Okay, so reach over to the table here, Bob. Can you tell me, do you have any allergies to medications?
No.
Okay, we're going to get you to wiggle to that table if you can for us.
Nice and slow, Bob.
Make it easy.
Wonderful. Great job.
That's great. Look at this one. Get the stretcher up. Okay, Bob, we're going to be prepping your groins as well as your wrist. We're going to have the groins ready just as a backup, okay? We'll give you some medications in your intravenous that will relax you and take some of that pain away for you.
Bob, it's Kelly, one of the nurses from the cath lab. Like Kathy introduced me. I'm just going to put some pads on your chest here. They're going to be a little bit cold, okay? One's going to go above on your right side there, and the other one's going to go on your left. How you doing?
Good, I think.
On a scale of 1 to 10, Bob, how is that pain right now?
4.
Okay.
Okay, we're just going to put a cover right over you here, Bob.
There you go. You can bring this right arm up here. That's great. If you can hold it like that. Okay, Dr. Hussain, we're ready to go.
All right, Kathy, we'll start with one of our set 50 fentanyl 50 gravel. Bob, you're going to feel a little pinprick here, okay? I'm going to start with some freezing here. Okay, a little pinprick, a little owie. All right, okay. And we're going to start with a little poke. All right. And the tube's going in shortly. You're going to feel a little pressure. Big breaths in and out, big breaths in and out, and tubes in. That's the worst part for you. Doing well. Hanging in there? All right. Let me start with a JL35.
Sure.
Thanks, Kathy. All right. Bob, how you doing? Good man. All right, let's hook up. Perfect. All right. Let's take the cine. All right, so the left main's okay. There's a moderate disease in the proximal to mid-LAD. There's a severe lesion in the mid to distal LAD. Bob, you have another narrowing. We'll deal with that in a couple of days. Okay, boss? All right, let's come out with this. All right, can I get a JR4 guide, please?
JR4 guider.
Thank you. Thanks, Kathy. All right, we're hooked up.
We're all set.
Kathy, you're ready?
I'm
Okay,
set.
let's take a cine. All right, so there's a proximal RC occlusion. Bob, what if your arteries is blocked? We'll try to open that for you very shortly, okay? All right, can I get a whisper wire, please? And an introducer. Thanks so much. Thanks, Kathy.
Going in with a whisper.
All right, Kathy, you're hooked up, boss?
We're all set.
Let's take a cine here. All right, so a little bit of resistance going through. And, all right, let's take another cine. All right, fantastic. So we got some TB1 flow here already. So Bob, your chest pain will start to get better shortly, okay? You got some flow down the artery. There's a lot of clot there, but we'll help you out here. All right, let's take another cine here, Kathy. All right, so we're through with the wire. That's fantastic. All right, let's take a Pronto V4 extraction catheter, please. Bob, hang in there. How you doing?
Fine.
Yeah, chest pain getting any better, bud?
Feels somewhat.
Somewhat? Hang in there. Hang in there.
It's
So the
probably
flow's a little better. The heart attack's technically stopped now, but we'll make it perfect in a bit, all right? All right, pronto going in, and suction on, please. That's great. All right, let's take a cine here, Kathy. Thank you. And let's take another cine, please. That's great. Okay, pronto going down. We're beyond the lesion. And anything coming back, Kathy?
starting to flow back, yes.
Starting to flow? Great. Okay, coming out with the pronto. All right. That's great. Bob, how you doing?
Fine.
Hanging in there?
Yeah.
Rhythm's okay, Kelly? You're happy?
Yeah, he's in a sinus. His STs are coming down a bit.
Excellent.
Got a fair side clot.
Nice. Bob, so I think your heart attack stopped. We got a bunch of clot out, which is awesome. Okay. Kathy, when you're ready, we'll take a cine here. All right, Bob. So the artery looks a lot better. It's a big artery. You'll start to feel better in a few minutes, okay? Hang in there. Hang in there. All right, let's take a 3-5-28 Zions expedition, please.
3-5-28 Zions
So we're going to start putting in the culvert shortly, okay, Bob? All right. That's great. Zions going in. All right, let's look it up here. Got it. Thanks. And negative. All right, Zions going down. All right, Kathy, when you're ready, we'll take a cine. All right, so that's nice position. You're ready.
All set.
All right, so going up on the stent to 8, 10, 12, 14, 16, and 18. And
18.
let's take a cine here. All right, so that's a nice expansion. Bob, you're going to get some chest discomfort again. We're just putting in the culvert. That's normal, okay? Hang in there. Hang in there. And we'll hold it up for a bit, and down from 18. Thanks,
Down from
Kathy.
18.
All right, so stent catheter coming out. Excellent. There you go. How you doing, bud? Okay? Hanging in there? You're doing well. Keep it up. All right, let's take a cine here, Kathy. Nice, Bob. So we got a brilliant result in the artery. Brisk flow. You'll start to feel better shortly, okay, man? All right, so we're coming out with the wire here, Kathy. All right.
Guide wires out.
Let's take our final cine. Excellent. All right. So we got brisk flow here, Bob. So the heart attack stopped. We got a nice result in your artery, okay? You doing all right? All right. Guider coming out.
Guide catheters out.
Okay. If I could get a TR band, that'd be great, Kathy. Thanks so much. So Bob, what we're going to do now, bud, is we're done the procedure. You have another narrowing in your front artery. I'll see you in a couple of days and we'll take care of that for you as well. I'm going to put a little band on your wrist here, okay? Cassie's going to tighten that, and tube's coming out. Big breaths in and out, big breaths in and out. That hurts a little bit. Wonderful. Band's on. Good job. All right, so let me just tell you a little bit, Buzz. So we put in one stent into your right artery. Looks very good. Good flow. Heart attack stop. We'll look after the other one, as I said, okay? You got to take an aspirin a day lifelong. Second medicine called Plavix or Ticagrelor. We'll take that for 1 year. I'll write you the prescriptions. Fantastic news that you got here in time, very rapidly to RVH. That way, we save a lot more heart muscle for you, okay? Your wife's actually waiting just outside in the waiting room, okay? The nurses have been in contact with her. So that'll help, okay? You can see her right on the way out, actually, all right? And God willing, if everything goes well, you'll be home in 3 days, all right? You got any questions for us? Okay, yeah? All right.
Wasn't that incredible? So very real. Sorry. And so very real for many of our friends and neighbors. This presentation clearly illustrates how important it is to have advanced cardiac care close to home. Most importantly, it has shown us the difference it would make in people's lives. There is something you should know about this demonstration. None of these people are actors. I'd like to introduce you to RVH's first interventional cardiologist, Dr. Farouk Hussein. our specially trained cardiac RN, Kathy Gleason. RN Kelly Smith. And our amazing paramedics from the county of Simcoe who are hiding back here. Darren Martin and Jules Young Williams. Let's give them all a hand. And not even our patient was an actor, although I'm sure most of you knew that. His cardiac experience was very real, but unlike this experience he's helped us show you today, his was much different. I'd like to invite Bob Kennedy to tell you his story. And I did want to point out that in case this didn't work out, the past chair of the hospital board, Rick Horst, is here, and he's in uniform as well.
Boy, I didn't have an audience like this before. Thank you, Arlette, and good evening, everyone. What you just witnessed, I lived through 2 years ago. The circumstances were similar to what you saw, however, my treatment path was very different. Heart disease was the last thing on my list in terms of health concerns. I always made my health a priority. I never smoked, I rarely drank alcohol. I walked quite a bit actually, and I played lots of golf. So for the most part, I led a pretty active lifestyle. So one day when I had trouble catching my breath while walking a short distance, I was, shall I say, more than a little concerned. But like most men, I just brushed it off. The symptoms of being easily winded with minor exertion went on for about 4 days. At the persistence of coworkers, I finally visited the emergency department here at RVH. What happened next felt surreal. In less than 90 minutes, a physician in the emergency informed me that I had had a heart attack and that it was still bubbling, to use his word. I was shocked. My next surprise came when I learned that I would have to leave this new modern health center to be treated outside of my community. That revelation stunned me. I was perplexed as to why I would have to be transported from this first-class facility with its own cardiac staff. It was very unsettling to learn that I would have to be uprooted from the comfort, familiarity, and security of my own hospital. I had my heart attack on a holiday weekend, so I had to wait at RVH. For the next couple of days, I felt like I was in limbo. It would be 6 days before I was taken by ambulance to Newmarket for the angiogram that would save my life. And then I was transported back to RVH the same day. I am grateful that I am here to share my story, and in the words of the cardiologist as he was performing the angioplasty, it continues to resonate in my mind to this day. He said to me, "You were a very lucky man. You dodged a huge bullet." I cannot say enough about the attention and care I was given by the staff at South Lake. However, I have to be honest, the fact I had to travel for treatment added unnecessarily to my stress that was already a very scary ordeal. It would be 8 hours after my angioplasty before I would return to RVH and finally see my family. Arriving back in my bed at RVH late that afternoon was the next best thing to going home. I just felt a greater sense of security and comfort being back in my own hospital, closer to my family. The next day I was released from hospital 6 days before my 61st birthday. I have much to be grateful for a loving wife and family, and my wife Deb is here with me tonight. At the time of my heart attack, my eldest daughter Sarah was expecting our first grandchild. I vowed while lying in the bed here at RVH that I was not going to become one of those cases where a grandchild never got to know their grandfather. Sarah gave birth to a healthy baby boy 2 months after my release from RVH. She is now 2.5, and there's not a day when I see Wesley that I do not count my blessings. I'm sorry. There's every possibility that I would be not here today if not for the incredibly talented and dedicated doctors and nurses here at RVH. I didn't realize it would be this emotional. They deserve our full-fledged support in their campaign to bring advanced cardiac care to our community in order that patients like myself no longer have to leave our home hospital to get the level of cardiac care that they deserve. I have every confidence this fundraising campaign will be a great success. I could not be happier for the group of tireless professionals at RVH who deserve nothing but the best in terms of the facilities and technology that we provide them. Above all else, I want to thank each and every one of them for giving me a second chance. I never thought I would be standing here today telling you my cardiac story. The fact is, none of us know what will happen to us, but it's good to know that you can count on the dedicated team at RVH to be there when and if you need them. Thank you very much.